Hey, what's up, everybody? It's Steve the Hurricane here, and I am super duper excited about going through this presentation with you all today. I am so excited to just be covering this information with you, talking about opening up America, because it's been a while since I've done a public webinar, and a lot of things have changed over these last, say, 2, 3 months, ending last year, beginning this year. There's been a lot of changes to our industry. There's a lot of uncertainty as to what's going to be happening in our industry. And so I put this webinar together. I've done a lot of research for this webinar. I actually have some great treats and surprises for you too. I have one of my top mastermind clients who is live with us on this webinar. I'm going to introduce her to you in a little bit, as well as, last year was her best year ever. She billed out over 140,000 hours of services. Like, I want you to put that into perspective as to just how many hours of service that is, and what kind of an operation it takes to be able to run that during COVID, right? And everything else that we went through. So it's absolutely incredible to be able to see that. And so again, this is what we're discussing. This is what we're talking about here. And I'm just excited to be able to share this with each and every single one of you. The other thing that I wanted to touch base on is I did promise all of you a free gift at the beginning. So I'm going to go through all of that with you. And, we're going to talk about the administration change. We're going to talk about the $15 minimum wage increase and what that looks like and what does that mean for your business. We're going to talk about your 5-year plan, the next 5 years. We're in a new millennium, a new decade, not millennium, a new decade. 2020 officially was the last year. A lot of people don't realize that. 2020 was the last year of the second decade. 2021 technically is the first year in the next decade of this century. So it's a very exciting time, but what does that mean for us as we move forward? And so again, this is what we're going to be discussing today. And for all of you, I'm your host. I'm Steve the Hurricane, and I am excited to be here with you and, just to share these photos with you. This is a picture of myself with my lovely wife on the left here. Shortly after things reopened here in New Jersey, we went out to the restaurant. We are COVID-free. We've had about 5 potential COVID scares last year, and not once did we get it. I actually believe that my wife and children and I all had it in the fall of 2019, as they missed a lot of school. We all got sick with this mystery pneumonia, because we were never actually diagnosed with pneumonia except for when they looked at a chest x-ray in November of 2019. So it's very interesting that happened. We probably should get tested for the antibodies. But anyway, we still live our life and we go one day at a time. This middle picture here, these are my 3 babies. This is Steven, this is Sydney in the middle. She turned 9 today, this morning. 9 years ago was the day that my hair started turning gray, because she is our energy child. And then this is my baby Sienna right over here, and this is our doggy Kit Kat. He's a long-haired Chihuahua, beautiful baby. I got real fit in 2020, and I'm continuing that this year. I know a lot of you follow me on social media, and I just committed to a healthy eating plan. I eat a ton of food. A lot of people say, "Oh, Steve, you got too thin. You got too thin." Thank you so much, dude. Very grateful. Oh, you're too thin or whatever. Dude, I'm 225 pounds, so I'm a big dude, but I like to work out. I like to stay in shape. And then also, I turned 40 last year, and so I decided to do a medieval Oktoberfest, because my birthday's in November. So I did a medieval Oktoberfest German party, and this is my sister and my brother, and we just had a blast outdoor. And so, this is me. This is who I am, and that's who I am personally. I like sharing it with you because, hey, it's been a while for some of us, and, we're doing well and we're continuing to move forward. And that's kind of what brings you to the next slide here. As you see, these are our clients. And everything that I'm going to be sharing with you, I don't want you to think that, I just made all this stuff up. No, I'm giving you real data based on people who executed everything that I talked about all the time. This is from 2020. You know, this lady right here, Debbie, absolutely love her. Met her down in Florida when I was there with my family on vacation. She's one of our clients. She grew her business by more than 30% of what she did in her best year prior to working with us. So that's tremendous growth. Here's another one of our clients, and you can actually see, this is Tom. He got on the news doing the things that I discussed and shared and trained him to do last year. And as you see in his testimony that he wrote at the bottom, even though all the crap that he had to deal with COVID that we all deal with every single day, he grew his business by 50%. I'm sorry, 48% over what he did in 2019. So he literally grew his business by half of what he was doing the year before. He was already doing a great thing the year before. So it's absolutely incredible. Here's another one of our clients who's out there just totally dominating it. They went from being not ranked in their franchise system to being the number 2, number 3 location in their franchise system. You know, this is the marketing representative. She's also the daughter of the owner, this is her father right here. He also made it on the news doing the things that we discussed and trained last year as well. And then here's another one that you see where somebody was able to increase their conversion ratio by 20%. They literally doubled their conversion ratio, which gave them a 600 weekly billable hour increase in just 6 short months. They went from 1,500 hours to 2,100 hours, as you see right here. In this one, here's another person who had an amazing time growing with us from 2018 through last year. They have tripled their business, not doubled, tripled, all right? I don't know the exact numbers, but imagine you have $1 million business and in 2 years you're doing $3 million, right? That's absolutely absurd. That's absolutely ridiculous. Here's another person right here who had another tremendous growth opportunity working with our coaches. And it just goes on and on to show you that everything that I'm teaching my clients, when they execute it, their revenue is going up, they're helping more seniors, and they're able to fulfill the purpose with which they set out, and they're living their life. So I am more than qualified. I've literally helped people grow their businesses by more than $1 billion since we've opened our doors. And I'm not bragging, I'm just letting you know that this is the right webinar for you to be on right now. And so for the free gift, as I told you, I like to give back. I like to help people. If you're not already a client, because if you're a client, you already have all this stuff and you've already received a lot of stuff with us too. And we love you guys. We want to work with you, but I want to give people who aren't working with us a chance to be able to do this. The first 50, all right, there's 300 people. The first 50 of you who email session@homecaremarketing.net. All you have to do is email your best phone number. Now, my staff, they're in the next room. They're in our main conference room over here. They're going to be calling people during this to schedule your coaching session for this week. This is for the owner, all right? Because everything that we're talking about is scaling and growing your home care business. So this is for the owner. It's not for marketing reps. It's for the owner, all right? But the first 50 of you that we receive an email from, we're going to schedule and book those appointments for you. So send that email. Just do it right now. Session@homecaremarketing.net. Session@homecaremarketing.net to get your free coaching session as my gift to you. This normally, we charge $250 for this. That's what I wrote in the email to you. That's what we charge for a coaching session. We're going to give those away for free. So if you add it up, if I did the math real quick, how much am I giving away for free? 50 times 250. I'm giving away $12,500 worth of services right now to the first 50 people who email us and ask for that coaching session, all right? Because I'm serious about helping you open up. I'm serious about helping you grow your business, and I'm committed to doing this. I've been doing this for years, and I want you to be able to scale and grow, because I know you scaling and growing means, yes, you're gonna make more money, but it also means that you're gonna help more seniors. You're gonna help elevate home care, because home care really got pushed to the forefront last year with everything that happened with COVID. And this is our time, 2021 through 2030, this 10 years, this is our decade to take a seat at the table with the rest of the healthcare industry. So if you haven't done it already, go ahead and do so. I will remind you at the end in case we still have spots left. I don't know, but my staff will be calling you. So make sure you email us your best phone number where you can be reached at session@homecaremarketing.net, and you do that now and move forward. So the first thing I want to talk about is the election. You know, whether you voted for Biden, whether you voted for Trump, whether you voted for Jo Jorgensen, I think was her name, or somebody else, or you wrote in Santa Claus, or you voted for yourself. There's a new president now. All right, there's a new administration now. My buddy, and I'm going to be sharing with you some data from Merrill Lynch. So, you know, one of my longtime friends, for those of you who are a client of ours, if you participated in the webinar last week that my buddy Brant Zimmerman led, he works at Merrill Lynch, and we were buddies right out of college. We lived in the same apartment complex. He's the person who turned me into a wino and a wine connoisseur back in the day. He has some really bad stories that I would never say online that he can definitely, you know, get me in trouble, but I have some stories about him too. And I asked him to put together this webinar that he did last week because I went into healthcare through home care. He went into finance and investing and working at Merrill Lynch. Now he's a high-powered executive. He lives outside of Washington, D.C., and he literally studies this stuff every single day, and he creates presentations and webinars and everything else for Merrill Lynch. So he's a credible source. So the biggest thing that everybody is concerned about, well, several things. One is the stock market. You know, the stock market right now is very, very high. It's at a record high number, and it's been on this record high trend for the last, say, 4 years, maybe 5, towards the end of Obama's second term. It started to rise up and hit some record numbers, but now it's at over 30,000 points to Dow Jones, and there's lots of money that's being made. I myself made 6 figures in the stock market last year, just in the stock market. You know, I invested when the stock market tanked a little bit, and a lot of those made returns. I had stuff that I put in before that happened years ago, and I cashed out of it, et cetera, whatever. I'm very big into this. And so one of the questions that came up that Brant found out and gave us some information and data on is, you know, historically, because a lot of people are concerned, when is this stock market bubble going to burst? You know, because, and then why is this important for us if I'm not in the stock market? Some of you watching this might be like, well, I'm not really in the stock market, so why is this important for me to know? It's important to know the financial outlook of a country based on what's going on with the trade industry, because this is where the stock market goes, where our economy goes. So if the stock market tanks and crashes, our economy tanks and crashes. So they're interdependent and related on one another. So what this basically means is since 1871, so we're talking about 150 years, 160 years of data, almost exactly 150 years, 150 years of data. Whenever there was an explosive growth year like 2020 was, the year that followed gave a better than average return, which means it's not going to all of a sudden crash and plummet. Now, could it happen? Of course, anything can happen. But the truth of the matter is it's going to be more of a gradual process. Things don't just go bad and sour overnight because somebody changed office on the 20th of January. So if anybody's worried about the stock market, this is the forecast, the outlook based on the historic trends of the last 150 years of the U.S. economy. The year that follows a pop year in the stocks are traditionally a better than average year. So assume an average year or a slightly a better than average year. All right, so you see that 14% is the better than average versus 10%, which is what it usually does. So that's what you can expect based on, you know, the 17% and 20 times the earnings that people earn in 2020 for a stock market, and that will translate and trickle down into the rest of the economy as that goes to jobs, that goes to disposable income, that goes to the ability to eventually afford services as it goes through. The next point are taxes. You know, it's so funny. I actually was looking through my tax returns for something personal my wife and I are doing. I'm investing in real. I'm doing a lot. I do too much. I need to take it easy. I'm going to go to Key West next week with my wife and just get away from everything and disconnect. But you know, I'm looking to get into some real estate, so I was just looking at all of our tax returns and getting all the stuff ready so that when we move forward, we can do what we have to do. And I was laughing because in 2018, which was the last year we had to file before President Trump's tax codes went into effect, my tax return from the business was like 28, 29 pages. And then when Donald Trump's tax changes came into effect, you know, filing in 2019 for the 2018 calendar year, that tax return, I believe, was like 17 pages long or 18 pages long. So I was laughing. I was like, man, I'm going to miss these tax breaks. But what does it mean for us as business owners, knowing that most business owners fall into that top 1% income bracket? So if you're making 1% income bracket nationally, you're the one that's going to be getting the biggest change in the taxes. So what Brant basically said, and this is what every financial advisor and expert out there says, is that what is the priority of Biden right now? His highest priority above all else, no matter what anybody can think or whatever, is ending COVID. Getting the country open is mission number one. He's talking about the vaccine and everything else, whatever. I actually was sharing an article. If you follow me on Facebook, social media, you'll see I actually shared an article on Sunday, I think it was, or Saturday, and it was talking about how as early as April 1st, things should be able to open up and return back to normal, when right now, fact, 41 million Americans have already been vaccinated. 41 million. And then you have 32 million who have had it and beat it. You add that together, you're talking about, you know, 73, 74 million Americans, which is about 20, 25% of the whole population, have either had COVID and have the antibodies or have been vaccinated against it. And so with 1 million people every day getting the vaccine, receiving it, it's only a matter of a month or two before more than half of our population has what it takes to be able to beat the coronavirus vaccine. So I expect things to come soon. But because of that, knowing that, you know, Biden is in office, the House and the Senate are Democratic controlled, and I'm not getting into Democrat or Republican, I'm just speaking a truth. Eventually there will come taxes, but it's not gonna happen this year. Anything that has to go into effect, just like when Donald Trump changed it during his term, it was one of the first things that he started, but it didn't go into effect until 2018, 2 years after he took office. So the same situation here. He's saying early 2022, but most likely 2023 is when it'll impact the changes from how we pay our taxes. That's just, again, you know, straight from Merrill Lynch and what they're anticipating based on what they have to do as priorities before getting to this. So is it coming? Yes. Don't let it hold you back now. It's not coming for a while. Do smartly plan and prepare in advance for it and take into consideration some of the things I'm discussing here today. So now let's talk about the push for $15 minimum wage. Because this right here is something that I get every single day when I talk to our clients. And I'm gonna say about 85% of my clients right now today are in markets where it's not $15. And everybody is freaking out. Everyone's melting down. Oh my God, $15, what am I gonna do? Ah! Calm down. The first thing I can tell you from every market that is already at $15 an hour, that's where I'm gonna give you the guidance on this one here. Every market that's already $15 an hour, it was not overnight. It was not overnight. They cannot do it. There's no way you can go to a business, any business, small, large, doesn't matter, and say to that business, you have to pay, if you're paying $10 an hour minimum wage right now, all of a sudden you got to pay $15 an hour to all of your employees. That would create mass layoffs. That would create hysteria and turmoil. It's not going to be overnight. The $15 minimum wage increase, which, I'm just going to say embrace it because it's coming. So there's nothing you can do about it. We can complain about it or we can prepare for it. Let's prepare for it. I'm a forward. Let's just move forward. It sucks, but it is what it is. Let's plan for it and be ready as it happens. It's going to be gradual. That's what it's going to be. It's not going to be overnight. It's not going to be tomorrow. It's not going to be next week. It is going to be gradual. It's going to take time for them to be able to put this out. Probably, I'm going to say 5 to 7 years is my best guesstimate. In most of the markets around the country where it is $15 minimum wage, it was about 4 to 5 years to get to that point, and that is what I would expect to have happen. So plan and prepare for it now. Make sure that you have price increase letters ready to go so that when you have to increase your rates, you can send it out to all of your clients. Let them be aware of it. When you sign people up, let them know that, hey, there's a push for $15 minimum wage. As that wage increase comes, we will have to pass it on to you, our clients. Just be upfront and real with it because that is what you're going to have to do. People understand. Everybody sees what's going on in our country and they respond and react accordingly. So don't freak out about it. It's going to happen. Now, one of the things that I'm going to talk about later on when I bring my client on with you, she's in a market where she's charging $30 plus an hour. So for those of you who are like, oh, I can't, if I go to $15 an hour and I'm charging 26, I'm going to have to charge $32 an hour to be able to keep the margin and do what I have to do to run my business. People can't afford that. We're going to talk about that in a few minutes, and I don't want to say it myself, I want you to hear from somebody who's talking to clients every single day, charging $30+ an hour, all right? Because it can be done, it will happen, just be prepared for it, embrace it, don't be afraid of it. It's just another part of running our business. Now, the next thing I want to talk about is the vaccinations and the marketing. You heard me talk about it before. Right now in the United States, about 73, 75 million people have either been vaccinated or had this and have the antibodies to defeat it that we know of, not including people like myself who I think that I actually had COVID before COVID was actually a thing, right? So, there's a margin of error there. It could be as high as like 150 million people have had it without realizing it. If you factor in all of the human error that goes into it, or people who were sick who didn't go and get tested, or all the other good stuff, right? So as far as the vaccination is going, it's healthcare. We are healthcare. I'm going to say go for it. If you're comfortable with it, if you're not susceptible, go for it, get the vaccine. Here's why. From the marketing standpoint, I have clients in all markets around the United States right now who they themselves and their marketing reps have been vaccinated. And they themselves and their marketing reps now are able to go back into the hospitals and screen patients and bring them home, back into assisted living communities. And they're doing sponsored activities and they're doing marketing things the way it was before COVID, because once you're vaccinated and the communities and the hospitals and the places you're going to, because remember, who did they start with? They started with healthcare workers. So once all of your healthcare communities are vaccinated and you yourselves are vaccinated, they will allow you in. It is already happening. So for those of you who are like, well, I don't know if I want to do it, or I'm not sure, I totally get it. I completely understand. I do. But just recognize that if you do, you're going to be among the people who are going back into the communities and marketing the way it was before COVID. That is huge in the direct referral marketing. You want to scale and grow your business, you have to be able to go inside these accounts and get the relationship going. I'm going to tell you right now, people are tired of Zoom. They miss lunch and learns the way that they used to do them. They are. How do I know? Because my clients are, when I showed you all those people at the beginning, right? This is what they all did this stuff last year with COVID. So they're all getting welcomed with open arms. Oh, thank God. And you know what else happened too, by the way? This is a phenomenon that I was teaching people that's going to happen when you start to do the things the way that I'm talking about it, right? This phenomenon is being created of the you were there when. So all my clients, 2020, with all the hardship that they had to go through and the difficulties of marketing and all the extracurricular and all the added things they had to do to be able to market and scale and grow their home care business, these referral sources, the reason why they're allowing them to come in now that they're vaccinated is because they were there when the world was shut down. They supported them when everything was closed. So now they're allowing them, they're not allowing everybody, but they're allowing them to come in and work with them because we went through this together and we want you here to have a long-term working plan with you going forward. And that brings me to the last point before I bring on my client, because this is so important. I just talked about, this decade is the decade of home care, right? Home care is on the map. Assisted livings are hurting and dying right now. Adult daycares are hurting and dying right now. Not all of them, but in general. People don't want to go into communities. They're trying to stay home longer. This is a golden opportunity for us to be able to do this. So with that 5-year plan, what can you do to scale your business from where it is today to get it to where you want it to be over those next 5 years? What does your referral source development look like? What are you planning to do with your referral sources this year? How are you embracing the people who can feed you business so that you have a long-term relationship over the next 5 years? Because over the next 5 years, there's something else that's going to happen. And this is what I'm talking about, exiting. Right now, today, I have over a dozen clients who are ready to exit their business. They started working with me, coaching and consulting 3 to 5 years ago. Think about what I'm saying. 3 to 5 years ago, they started working with me coaching. I helped them grow their business 25% the first year, 30% the second year over what they did the first year. The third year, they grew another 25% over what they did the second year. And so on and so forth. Now they're ready to go. Now they have this big multi-million-dollar business that was doing $700,000-800,000 when they started with me 4 or 5 years ago. And now this multi-million-dollar business, now they're ready to exit. If you find yourself right now and you're thinking about, Steve, I don't want to deal with a $15 minimum wage. Steve, I don't want to deal with finding caregivers. COVID burned me out like a dozen or so of my current clients. They're ready to exit. Home care businesses right now today, because it's the hottest business to get into, are worth more than they have ever been worth. Now, I want you to write down some multiples here. I have spent the last 2 months, about 30, 40 hours, speaking to brokers and investors and private equity firms and large corporations that acquire mergers and acquisitions and so many other, multi-million, $100 million, $500 million executives or board of directors. Or I've been speaking to all these folks a solid 40 plus hours over the last 2 months of this year because so many people are looking to exit. Now might be the time for you to exit. It might be right now, or you may want to have a last hurrah for the next 3 years. I'm going to grow this thing as big as I can because I want you to write this down. Business owners, this is an owner-focused one, right? They're going to look at your 3-year look back. What kind of revenue did you generate over the last 3 years? So if it's poor, then the next 5 years, what am I going to do over the next 3 years? Knowing that if one day I exit my business, they're going to look back over the last 3 years. And it's not so much about the total amount of revenue, although I'll come to that in a minute, but it's really about the growth. So as I told you, my clients who I'm helping to exit, they've all grown 25, 30% year over year over year. That is a much more valuable business than the business at the same revenue that's been plateaued at the same point, growing 5%, 6% every single year for 3 years' time. You need explosive growth. So you have to be planning for explosive growth over the next 5 years if you're thinking about exiting your business someday. Here's another thing they're going to take a look at: the multiple of your profit margin. Your profit margin. If your profit margin is low, you're probably going to get around 3 times what your profit margin is. Meaning, I have $1 million business and I made $100,000 for myself. That's low. somebody would buy that business probably realistically for about $300,000 to $400,000 in revenue, depending on a bunch of other variables and factors. Now, say I have the same $1 million business, but the profit on it is 20%, which means I'm keeping $200,000 on $1 million for myself as the owner. Well, now all of a sudden that same business is worth more like $600,000 to $750,000 because the profit margin is so much higher. That's a 3 times multiplier. Now, I will tell you that when your business breaks $3 million, which is a great milestone, because this is a 5-year plan, right? What am I saying? My business did, well, Steve, you know, my business did $2 million. Okay, great, let's get it to 3. Because when you get to $3 million, that multiplier goes up 1 whole point. So when your business is at $3 million, and say you have a 10% profit margin on $3 million, which is $300,000, you're looking at a 4 multiplier, which will get you $1.2 million in revenue for the sale of your business. Now, if the profit margin is higher than that, and it's closer to 20%, which it should be. My clients are, when you're having your coaching session, if your profit margin isn't 20%, talk to the coach about that. They can help you with it, and we can help you get to where you want to be so you have that 20% margin, because that's where it should be. A $3 million business, 20% profit margin is $600,000. A 4 multiplier on that business could get as high as $2.4 million. $2.4 million on a $3 million business. Isn't that interesting? Think about that as you're planning your 5-year plan. I want to scale it. Steve says I got to have double-digit revenue percentage growth for at least 3 years consecutive to really max out these multipliers he's talking about. And if my business is at 2 million, he says I got to get it over 3 to get that extra multiplier in there. And it does work like that. Why? Because it's more valuable to the new buyer. Somebody who's going to buy your business and give you $2.5 million for a $3 million business, you're going to get $2.5 million right now. They want to be able to recoup that inside of 3 to 4 years, right? That's why that multiplier is there, and be able to continue to expand and grow, and maybe one day turn around and flip it as a $10 million business. Who knows, right? That's not for you to decide. That's for the person buying your business to decide. But these are things that you have to plan now for your next 4 or 5 years. And then the last thing is for those of you out there who are watching this, who have businesses like mine back in the day that were doing over $5 million in revenue. Yeah, you're going to be getting close to, if not more than dollar to dollar for what your business is generating. If you're doing 5, that's the next level up milestone. I have a friend of mine who sold their business, home care, worked with them, talked to them, known for a long time, sold their business, doing $7 million in revenue, and got paid $8 million for that business because it was over that 5 million multiplier. It's a very low risk investment. Equity firms come in, they want to buy it, they want to scale it and do things and put more money into it, hire more people and expand. And they're looking for these big hub businesses, these $5 million plus a year private pay home care businesses with a 20% profit margin. So you're making $1 million, $1.2 million, $1.5 million as profit on that $5 million business. That's what they're looking for. They're going to pay you that kind of return on investment. So for every single person on this webinar right now, over the next 3 years, I don't care if you're brand new and you're just getting started and you're at 0. Your goal has to be to show this continual steady and understand the numbers that I'm saying. That has to be part of your plan, because eventually one day you will not be in this business. And if you build it right, when you go to exit this business, not only will you have helped a lot of people, because you're going to be able to retire and live the rest of your life and do whatever you want to do. Get a beach in Boca Raton and walk on the beach and swim in the ocean every single day. Go buy a ski lodge in Colorado and ski every single day in the winter and do whatever. You want to go to Paris, honey? You go to Paris. You want to go to Giza? You go to Giza. You want to go see the pyramids? You go see the pyramids. You want to go see the Taj Mahal? You go to the Taj Mahal. Do whatever you want to do in that time. Work hard, play hard, right? That's what it's about. This 40-year-old man is telling you that's what you got to do if you want to do it, as somebody who's helped hundreds of people do exactly what I'm talking about with you right now. I'm telling you, this is the best webinar and the best use of your time, because I guarantee most of you didn't even think about what I was saying until I said it. Now you're probably like, oh, snap, I need to get that coaching session. So I hope you got that coaching session because there's only 50 of them. There's 300 of you here. So make sure that you get that coaching session and talk about this if that's what you want to do. How do I scale my business and do what Steve just said in that webinar? That's a great thing to talk about. So speaking of, clients who are killing it and crushing it, this is one of my favorite clients. I love them to death. They've been working with me now for about 4 years, maybe 5. I don't know. I lose track of time. So maybe it was 2016. So it's about 5 years now. And they're absolutely fantastic. And you see on the screen here, it's, to the left, this is to my left in this picture, as you're looking at it, is Stacy. And to my right in the picture on the left is Franny Schmidt. And the picture on the right, this was actually about 4 weeks ago. I flew out to Colorado and I did a 2-day training. I trained their office staff and did all these amazing things for them on day 1. And then on day 2, they took me to the mountain. We went snowboarding and skiing, and it was great. Stacy did not fall down the mountain at all. We went on a couple of slopes that we had no business going on by accident because you get lost because the signs aren't really that good. And I remember telling my brother when I came back, I was like, Scott, at the top of the mountain, it's 12,200 feet high, and the air is so thin, and my legs were burning, and I couldn't catch my breath, and I thought I was going to pass out, and the challenge of snowboarding down the mountain was so challenging, and it was amazing. My brother's like, that doesn't sound amazing to me. But I absolutely loved it. And so, without further ado, and you see the wonderful Franny Schmidt here with me. So your picture there is you could read all the things she's done. I love the fact that she's involved with giving back, to street connected youth to help them out and help them get them out of a bad place into a good place. So she's a philanthropist that way. But really the big key here for you and not taking anything away from what she's done. She was able to take her business. I think she said you build out like 110,000 hours in 2019. And then you increased to 140,000 hours last year. That's a 30,000 hour jump. That's about a 20%, 25% increase in hours and revenue and everything else. That's a big business. So, Franny, welcome. Say hi to everybody.
Hi, everybody.
So I'm so glad to have you here as we go through this. And
I'm so happy to be.
I have 3 questions, and thank you very much for being here too, and everybody else too. If you have a couple questions, look at this. This is these questions are outstanding. All right. So anyway, I'm going to ask these 3 questions of you, and I want you to take your time and answer. So the first question I have for you, when we talk about the $15 minimum wage, 90%, 85% of the country right now is not charging $15. People are very afraid of it, not so much from paying the caregivers. Like, we all understand how hard caregivers work and they deserve more money. Like, we get it. But what we're really concerned about is to pay $15, or we know if it's 15, we got to pay like 17, right, to get a caregiver. It's got to pay more than minimum wage. So to pay that kind of money, we have to be charging like $32, $35 an hour. And is that affordable? What is it like, now that we know you charge more than that, so how are you charging that? What do the families say? How do you go about it? Talk to us a little bit about selling at an above $30 an hour price.
Sure. So for our existing clients, I guess, we haven't gotten a lot of feedback one way or another. We send out a letter each year, year over year, with a price increase. So this is not something that they are not, they're already used to it. They know that we're going to increase rates. They know that the majority of what we are billing and charging them does go to our caregiver. But in terms of, charging over $30 an hour, we do some secret shopping out in the community, of course. We've positioned ourselves not necessarily to be the highest, but also to not be the lowest. But for the most part, feedback's been very well received by our families. They appreciate the teams that we've got in place for them. They don't want to lose their caregivers. They understand that the bulk of that does go to paying our caregivers. We pay well over $15 an hour for our caregivers. We find that paying $1 or $2 more per hour saves a lot in terms of having to recruit. That retention piece is really important to us. It's easier to pay a little bit more, throw a little money at it, pay a little bit more for retention than it is to try and spend a whole lot of money recruiting new caregivers. In terms of selling out in the marketplace, the majority of our referrals are from our partners. So we're not getting a lot of price shoppers just in general. But I think our business development team does a really good job of just explaining the value add that working with a company like ours, where we're touching hearts at home, working with a company like ours versus just somebody who's maybe slinging warm bodies in. So there's not been any issue with charging that, and we anticipate that next year we're going to again raise another $1 or $2 more just to sustain with what's happening out in the marketplace in terms of keeping really great caregivers.
I love it. And then I want to just ask you on the same topic here. Did you do anything special or, you know, like a knee-jerk response with all the COVID and the PPP and stuff?
No, not at all. And I think that's probably something that occurred to a lot of folks out there, is that, gosh, you know, we were so underpriced or we weren't confident in our current pricing structure. We absorbed all of that. So we didn't do any big price increase. We didn't like freak out and start charging $5 more an hour to cover those costs. We did absorb it when we sent out that letter to our current clients, just explaining to them that price increase. We did include that we were going to continue to provide that personal protective equipment. We're continuing to offer weekly testing for our caregivers. So we didn't have to do anything crazy because of COVID in terms of pricing.
So for everybody, because you gave, I literally have 6 pointers that you just said. So I'm going to repeat this for everybody so that they can make notes. I want to make sure I'm also mindful of the time. Yep, we got time. So, you know, the first thing she said was it's an annual thing. So this isn't something, and you know, and something that I talk about all the time. If you look at Home Care Pulse, they put out a survey every single year. The typical home care company operates at about 65% of the price they're charging goes towards all things caregiver related. That's recruitment, that's retention, that's salary, that's bonuses, that's overtime, that's everything. One of the biggest differences between what that says, and that's the industry average, and what I train my clients on, my coaching clients, my mastermind clients, the ones that invest with me, because it takes time to get all this stuff going. I teach them to be able to operate at a 60% caregiver margin, which means that we're charging an above average price. So Franny said that they're not the highest, but they're not the lowest. It's competitive analysis, and that is where you want to be. That's part of what we're going to do with you. Now, the secret shopping, I love that you did the secret shopper because that lets you know where you fall in there. You should be on the higher side of average. When you're scaling and growing and doing all the things that I talked about on here, having the best practices. Fran, you also mentioned for every $1 an hour, and this is a Home Care Pulse stat, for every $1 an hour more that you pay a caregiver, that translates to 5 to 10% reduction in your turnover rate. So it's worth it to pay your caregivers $2 to $3 an hour more than everybody else, because that's going to help you with the retention of the caregivers just as much as anything else. So it's interesting that she put that in there. And then I also love that she had mentioned, because it's more about keeping the caregivers, with COVID, I know a lot of folks had a knee-jerk reaction to COVID, where it was like, oh no, now I gotta do this, now I gotta do that. And people started doing COVID surcharges, or they increased their rates because of COVID. Franny didn't have to do that. Why? Because she already factored in as part of her business plan, and it took time to get this going, but she's been billing increasing every single year regardless. The clients are aware of it. They know it when they sign up. It's all part of the plan to be able to do this. So I love how that ended, because I know so many people who freaked out when it happened, and then also like, well, what am I going to do? And then also you raise somebody that you're undercharging, because that's exactly what you said. You know, most people are undercharging, they get slammed when it's COVID, there's no margin. Then they got to raise it $2 or $3 an hour instead of $1 here or $1 there. And then that's when you lose your clients. So it's steady, slow and steady wins the race. It's the best way to put that. And then the last thing that you said that I want to just touch on for everybody too is I love the way you talked about the marketing effort. So she's not getting a client who is like, oh, I don't know if I can afford it, or oh, I don't, that's too much money or whatever. It happens every once in a while, but usually when people are calling you, they're aware it's going to come because your marketers are working with your referral sources, and your referral sources explain that they got to pay for it. That's how it's supposed to be done, folks. I couldn't have said it better. Franny, that was phenomenal. The second question I got for you, you know, I mean, you scaled, you know, 110,000 hours in 2019, 140,000 hours billable in 2020. What kind of a recruitment effort and what kind of like day-to-day efforts do you put into getting more caregivers? Because that kind of growth doesn't just happen overnight.
It doesn't, and there's no secret sauce. I'm not going to solve this for anybody today on this call, but we do have dedicated staff. I've got about 1.5 full-time, or 1.5 persons, I guess, in our office, dedicated 100% of their time, most of their time, to recruiting and onboarding our caregiving team. We do daily stand up and every single morning talk about this. This is top of mind for our whole business, right? That we have no business if we don't have caregivers. So we spend a lot of time talking about gaps. We do a lot of forecasting and projecting. We talk about clients that may be at risk. So care teams that might be rolling off of clients. We talk about business development efforts that are happening in certain areas where we maybe need to hire for that. So there, you know, it's something that we do day in, day out. We've tried everything under the sun in terms of recruiting. We certainly do online. We've got referral bonuses that we pay our caregiving team for referring somebody. I think probably most everybody is doing that right now. We've continued to do online, in-person interviews and in-person training. So we did have to take a little bit of a hiatus there, and we did some different things with our training and onboarding. But we still want to, we've just had to plow through that. We want to get eyes on. There's a lot that you can see and say over the phone, but being able to interact with that person face to face is really important for us. So we're still doing online interviews, Zoom interviews, but then bringing everybody in for training and in-person interviews. Yeah.
Because I know that. See them. Yeah, the in-person I think is important because, and I know this, everybody who's on here is at a different stage here, but I love that you bring people in. So yeah, you started out virtual, but then you bring them in before you go into someone's home, because this is home care. You know, it's one-on-one. We're in the home, so you gotta know who you're sending in someone else's house. So I'm glad that you did that, and you're doing it. And you know, for everybody on here, make a note of that, because I talk to a lot of folks who are still doing things virtually, and it's just, this is healthcare. You know, I know people are worried about COVID, but then don't be in healthcare. You know, like that it really is as simple as that. So, Franny, thank you for that one. And then the last question I have for you, and then we'll take questions from the audience here to wrap up the hour here. We got a couple of minutes still. You know, to bill out 110,000 hours and then increase to 140,000 hours over the next 12 months, that doesn't happen overnight. And I know you, and I know your business, but I also know other businesses in general. It's very seldom that you're getting one new client a week or 2 clients a week, and you lose 1 this week, and it's a very steady, gradual growth. It's more likely that it's like, here's 6 new clients this week, and then here's 10 more, and then we lost 4, but we got 6 plus, and then you get these pops, and it's very cyclical. You know, February and March could be explosive. You dip a little bit in April, then May and June could be another explosive period where you go up 1,200 hours, even though you dropped 600 before. So how do you manage these pops and these waves of new business coming in?
Great question. So I think, and our business might be a little unique in this way, but the majority of our clients are very high need clients. We have a lot of 24/7 clients. We have live-in clients. We have full-time clients. And so our pops and our highs and our lows, I guess, can be pretty significant either direction, but it's just because of the nature of our business. And so we don't do anything especially different. I mean, we're always going to be recruiting and hiring for that full-time caregiver. When we are marketing, we're telling our partners out there that we've got great teams that are rolling off clients. We've got great teams that are looking for full-time work. So we didn't see, it is a big pop, but we just keep those wheels churning. We've got goals for net hires each week, and that doesn't matter if we're up in hours or down in hours, because we're always anticipating that the next 24/7 is going to come through the door, and they do. And so, that pop that you're talking about is just kind of our day-to-day business, and we just plan for that, and we just recruit for that and market to that, and just expect and hope that we're going to see another 30,000, 40,000 hours increase for this year. We're planning on it.
I swear, number one, I'm super proud of you, because you're someone that I love you. I love Stacy. I love your entire organization. I've known you so well over the years, but I love what you said. And I want everybody to write this down back home. She said, it doesn't just happen. We planned for it. So, like, how does she handle the pop? The truth of the matter is the pop is happening on a regular, consistent basis because they planned for it. They made a plan, and now they're executing their plan. Some points you brought out, they have weekly goals. So every single week, what's our growth goal for this week? Now, sometimes you don't hit it. That's okay, because next week you're going to go for it again until you hit it. Then the next week, let's go growth. It's a growth plan. It's a pattern of moving forward, not backwards, and they plan for it. I also love that you said working with your referral partners. This is something that everybody needs to do a better job at. This is the difference between a company that's doing, 140,000 billable hours a year and 40,000 billable hours a year. That's a big difference, 100,000 hour a year difference. The difference is how you're working with your referral partners. And then the other thing that you mentioned, which I really love too, and this is straight to Hurricane Program, the things that, we always talk about, are high need clients. Franny's not sitting there talking about the 12-hour, 3-time a week bath visit, or the person who wants somebody to come in once a week. They don't even do that. They can't. It's impossible. She's talking about 24/7, 56 hours a week, 84 hours a week, medically complex clients. So people are coming to them, and I think that I got to ask you, Franny, does having clients with high need help, or do you think it helps with accepting the price?
Oh, without a doubt. There's no question. And again, they're all being referred to us. I mean, they're coming out of rehab. They're coming out of a hospital stay. They have those 5 or more comorbidities that we talk about in your training. And price is never it's seldom a conversation. Right.
And I love it. And that's exactly it. When you have, at the end of the day, right, think about it this way, folks. Our patients, our clients, they all come at different levels. They're all where they are. But you have a patient that's coming out of a hospital. You have a patient that's coming home, and they're either on hospice, or hospice is the next step. Like, you are the last step before hospice. To that person and that family, if they have the resources, getting the help is the priority. They understand it's going to cost money. And when you look in every market, and I'm sure where you are, but every market around the country, it's all comparable. To live in an assisted living in your area, Franny, it's got to be like $7,500 a month, $8,000 a month. Right. Mm-hmm. So So it's not a matter of is this patient going to spend the money? It's where are they going to spend it? $8,000 at the assisted living or $8,000 a month at the home care agency? It's apples to apples from a dollar's perspective. You know, in a nursing home, if somebody's really medically complex, like Franny said, they got to pay privately to be there if they have resources. That could be $500 a day, $600 a day, where they could come home with a caregiver for 10 hours a day at maybe $300 a day. You know, and again, what is the one that's one-on-one? We are as the home care providers. So this is, Franny, this is excellent. Thank you so much for coming on.
My pleasure.
And let me see if we got some questions here. I'll open it up for questions to the group for the next 4 minutes as we wrap out the hour here. So let's see. Oh, wow, there's a lot of good questions here. All right. So, wow, these are some great questions. All right, I hope so let me put this slide up real quick. Hang on. There we go. Okay. So everybody make sure you get your, because with the amount of questions we have, and we have 4 minutes, we're not going to get through all of them. These are things that you want to ask the coach on that strategy. The first 50, that's it. First 50, you're going to get it. All right. So here's a question. How extensive is your training for new caregivers?
Hours. Question to me. Okay. We have an orientation. We have them do some videos prior to coming into our training, and it's covering a lot of the basics that the state requires. We cover, it's about an 8-hour day for our caregivers. At the moment, we're doing a lot of experienced caregiver hires. So rather than spending a lot of time on personal care training that we do here that's required in Colorado, we're having them demonstrate competency, but it's full day. It's a full day of training, dementia care, state required topics, some interactive pieces with personal care. So it's a good day. It's fun.
Awesome. I absolutely love it. So I'm trying to find some questions. Another one here that's a good one for you. What are the key to continuing relationships? A lot of you ask about referrals. If you're charging $30 or more an hour for 24/7, that's over $250,000 a year. No one discusses that price. How do you this is somebody who's in awe of you. So they said, very impressive.
Okay.
Thank you. 24/7, how do people handle that?
Our 24/7 is almost $700 a day. It's a lot of money. It is not typically a long-term client. We have live-in that's considerably less, more comparable to that assisted living or skilled that Steve was talking about. Again, we're providing that one-on-one care. We've had some very long-term clients on that 24/7 rate. My suggestion, I meet a lot. I spend a lot of time with families, and when I'm talking to those family members, I'm talking to the kids, and I say, get long-term care insurance. Blow off the term. Nobody cares. You're dead. You might leave a little bit of money to your kiddos, whatever, but get that long-term care because you're going to live to be 100, and you're going to need that money to support you. It's no joke. It's a lot of cash. I don't know how a lot of people do it, but for the most part, that 24/7 is very short-term. It's hospice. Or maybe we start 24/7, initially someone coming out of a hospital situation, and then we scale down, and then we're looking at those 8-hour days. So it's a ton of cash. I know the math very well.
Yeah, I actually added up. I did 700, which you said is the rate that about, give or take, and it comes out to $255,500 for 365 days. But that's right. That's a very good answer there to you, Diane, who asked that question. It's most 24/7s are not long-term permanent. They do come, but they're few and far between. But if you have, think about this, like Franny just said, hospice, right? So the average length of stay for a hospice patient before they pass away is 18 days. So if you're, just throwing it out there to you, no matter where you are in the United States, if you are able to get, 3 hospice patients a month, 24/7 for 18 days consistently on average, there you can do your math. You can see the hours that are billed, you see the revenue that comes with it, and that's consistently. That's one hospice. Get a second hospice, get a third hospice, and then all of a sudden, you're literally starting up 2 to 3 24-hour cases a week, every single week, over the course of 52 weeks in a year, yeah, that's going to generate millions of dollars in revenue with each person paying their cut of that. And ultimately, putting money aside for a second, and I know Franny, you can vouch for this too. What you did allowed that person to pass away in the comfort of their home, not in a hospital somewhere,
right.
not in a rehab or a nursing home. They were at home. Do you get some of that feels about that? Does that ever happen to you?
I just covered head to toe in goosebumps. I mean, that's it. And the palliative teams that we work with at the hospitals and things like that. I mean, that we're all aligned. That's our goal. And whatever it takes to get this person home and to get them surrounded by family in the comfort of their own bed with their dog nearby and their pictures and all. I mean, that's what it is. That's it at the end of the day. That's spot on. Yeah.
Awesome. Franny, thank you so much. I want to be mindful of your time as well as everyone else's. So we're going to end here. There's still like 50 more questions, but I'm going to say to every person out there who asked questions that didn't get to answer, that's what this is for. This is why I gave you this time, because I want to be mindful of everybody's time. She's got a lot of clients that she has to get back to. It's 4 o'clock Eastern time. It's only 2 o'clock where she is. So she's got a lot of things she has to do. So everybody, email us your best contact number. We're going to call you, schedule us out for the next 3 days to give you your coaching session, answer these questions and more for you. Franny, anything you want to give the folks at the end as a last tip?
If you haven't already, please, by all means, email for that free session. I've got a quick funny story to tell. Steve presented to a group of owners in my franchise organization, and Stacy and I were sitting up front because we're just eager beavers and we're year one. And Steve was like, the first 3 people that sign up for my training sessions, get my cell phone number. And I leap out of my chair and I go running across the room, credit card in hand, and I trip over and I unplug the projector and cause all sorts of mayhem. But I was actually number 1. So thank you. And you won't regret it. Money well spent. Thank you. Thanks, Steve.
Franny, thank you so much. And I remember that. So I do remember the projector, remember everything. I'm like, we're going to get you covered. I'm going to give you my cell phone. We're doing a lot of business. So I'm very proud of you. This was fantastic. I know this is your first, and everybody, this is Franny's first time ever speaking to a group this large. So give her a round of applause.
I'm just talking to you, Steve. That's it. It's easy peasy.
Right. And the 300 other people, right? So
yay. Happy day, guys. All right. Thank you.
All right. Take care, my friend. Everybody else, have a great one. We'll talk to you soon. Thank you for spending time with us. Get your strategy session, the first 50. Take care, my friends.
Bye.